Overall public health benefit data from a large number of studies evaluating a wide variety of benefits in diverse populations generally supports 30 to 60 minutes per day of moderate to vigorous intensity physical activity on 5 or more days of the week for a number of benefits such as lower risk for all-cause mortality. In other words, reduce your risk of dying early. Coronary heart disease, stroke, hypertension, type 2 diabetes in older adults, and also younger adults. Lower risk is consistently observed at 2.5 hours per week. So it's 2.5 hours a week of exercise. It's not a lot of exercise. How many of you spent 2.5 hours on your phone yesterday? I would argue that probably more than half of you did. We're talking about take that time and just put it to something better. 30 minutes per day, right? 5 days per week of moderate to vigorous intensive activity reduces mortality risk by 30%, cardiovascular disease by 20 to 35%, metabolic disease by 30 to 40% in healthy populations. Show me a drug that can do any of that. Show me a bundle of drugs that can have that level of an effect. You can't, because there are no medications that have this kind of power, but you do. Remember, because the choice to exercise isn't preliminarily, you don't have to rely on your doctor to make that decision. You don't have to go ask your doctor permission to start exercising today. I know that's the TV wants to train you to think, ask your doctor if something is right for you, when in reality, your doctor's probably the least qualified to help you get healthy. Now, they're great at managing illness and symptom reduction with medicines, but horrible at helping you achieve health, and exercise is going to help you do that. Okay, let's talk about the effects of building muscle on autoimmune disease, because autoimmune disease is one of those conditions, it's on a meteorical rise in our country. This is a 20-year systematic review of the effects of exercise and muscle mass on autoimmune disease. So this is a large review. You can see here the studies were conducted in 25 different countries. Total of almost 2,800 participants, patients with autoimmune disease in exercise or control groups. Overall, the evidence suggests that inflammation-related markers such as C-reactive protein, interleukin-6, and TNF-alpha were reduced by regular exercise interventions. Regular exercise interventions combined with multiple exercise modes were associated with greater benefits. So why? Because it has anti-inflammatory effects. You know, it's when your doctor says you need to go on this medicine, what's the goal of the medicine for autoimmune disease predominantly, especially autoimmune pain conditions? They're anti-inflammatory. Steroids, what are called DMARDs, disease-modifying anti-rheumatic drugs that have anti-inflammatory effects, and now they have the new biologic class of medications which are immune-suppressing anti-inflammatories. So you can get the same effect. You can get an effect from some good old-fashioned muscle work. Here's a study on rheumatic disease and myokine regulation. Remember, myokines are the chemicals your muscles release. One of the most important of these advances is the discovery that skeletal muscle communicates with other organs by secreting proteins called myokines. So myokines are thought to induce anti-inflammatory responses with each bout of exercise and mediate long-term exercise-induced improvements, as in cardiovascular risk factors, having an indirect anti-inflammatory effect. Therefore, contrary to fears that physical activity might aggravate inflammatory pathways, exercise is now believed to be a potential treatment for patients in rheumatic disease. Let's read that again. A treatment for patients with rheumatic disease. How many people with rheumatic disease are told to quit moving, to just baby their pain? No, it's a treatment. You can get better outcomes with exercise. And this isn't the only study that has shown that. There have been many studies that have shown that. Let's look at this next one. Obesity increases disease activity of Norwegian patients with axial spondyloarthritis. Okay, so here what we have. Overweight patients had significantly higher degree of spinal stiffness and number of comorbidities. Obese patients had significantly higher disease activity and degree of spinal stiffness and number of comorbidities. So the results highlight the serious impact of obesity on health status, and obesity should therefore be considered as a modifiable risk factor for disease activity within the disease management of axial spondyloarthritis. So if you've got spondyloarthritis or ankylosing spondylitis or any other kind of arthritic spinal autoimmune condition, exercise. Here's a nice review. It looked at many studies. Again, this was 2,800 participants, 25 countries. These were all of this is a review of multiple studies. So these diseases here that you see on the right were all looked at and all improved by exercise. So if you have been diagnosed with multiple sclerosis, lupus, ankylosing spondylitis, rheumatoid arthritis, type 1 diabetes, inflammatory bowel disease, that's celiac, that's also Crohn's and ulcerative colitis, inflammatory myopathies, so if you've got muscle inflammation caused by autoimmunity, pemphigus foliaceus, which is a skin inflammation, or Takayasu arteritis, which is a swelling of arteries and an inflammatory autoimmune reaction of arteries, then research has shown that exercise has anti-inflammatory effects in those conditions. And if you're working with a rheumatologist, you know, ask your doctor if exercise is right for you. In all joking, though, go exercise. More than 100 myokines have been identified. Some myokines, including irisin, are responsible for many autoimmune diseases. Myokines, by means of their anti-inflammatory effects, can counteract the induction of insulin resistance and the loss of muscle mass. You see, idiopathic inflammatory myopathy, rheumatoid arthritis, lupus, and inflammatory bowel disease are myokine related, meaning get your myokines produced and have an anti-inflammatory effect that helps your autoimmune disease. These are some of the mechanisms when you want to look at autoimmune mechanisms of exercise. And it doesn't, you know, a lot of people are scared of exercise because they don't want to go lift weights. They don't want to go jogging. They don't like those types of exercise. But if you look at this, they studied and looked at aerobic training, resistance training, Tai Chi, Pilates, yoga, stretching, and just stability training. And so you can see the little icons down here and the different studies that were done. So if you don't just like weightlifting, you've got other options. And again, we're not trying to, this is not a message to go out and become a bodybuilder. This is just simply a message to go out and get some activity and exercise, take care of your body physically, and it will take care back to you. So you can see here in lupus patients, aerobic and weight training 3 times a week for 8 weeks reduced inflammatory chemicals, TNF-alpha, interleukin 2 and 4 and 5, which are all things that make the disease worse. We also know that, you see here, 3 times a week for 26 weeks reduced a litany of inflammatory chemicals, and then 2 times a week for 24 weeks did the same thing. So you have options. You don't have to go to the gym every day. We're talking 3 times a week. It's not a tremendous amount of time or commitment. A lot of people say, well, I just don't have the time. I would say, well, if you don't have the time to exercise, but you do have the time to go visit doctors all the time, I'd say you have your priorities screwed up. You need to get your head screwed on straight and take responsibility for yourself. Ankylosing spondylitis, same thing. We've got Tai Chi, we've got yoga, we've got resistance and aerobic training, all reduced inflammation. And in as little as just doing 3 to 2 times of exercise per week. We've got ankylosing spondylitis, same thing. Rheumatoid arthritis, same thing. You know, you come over here in multiple sclerosis, multiple trials showing reduction of inflammatory mediators. We've got Takayasu arteritis, same thing. Again, we're talking 2 to 3 times a week in most of these studies. So the commitment on your time front doesn't have to be tremendous. You just have to be consistent. Exercise is all about showing up. Consistency over time equals results that are beneficial to you and will help you overcome your illness.